Content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health care agency serving Dade, Broward, and Palm Beach County. For more information to reach All County, you can reach them at 954-717-7027 or info@allcountyhealthcare.com. I am your host, Dawn Graubert, and I am very excited to have joining us Dr. Armando Hernandez-Rey. He is a board-certified reproductive endocrinology and infertility specialist and the founder and medical director of Conceptions, Florida. He completed his residency in obstetrics and gynecology at the University of Miami Jackson Memorial Hospital, followed by a 3-year fellowship in reproductive endocrinology and infertility at UMDNJ School of Medicine. Dr. Hernandez-Rey specializes in complex fertility cases, including PCOS, recurrent pregnancy loss, severe endometriosis, and fertility preservation, such as egg freezing. One of only 2 fertility specialists in Miami offering robotic surgery, he provides minimally invasive options that often reduce recovery time and may help patients avoid advanced treatments like IVF. Known for his compassionate, accessible approach, he has helped hundreds of families locally and around the world achieve their dream of parenthood. His office is located in Merrick Park in South Miami, 305-446-4673, and he is affiliated with hospitals South Miami, Baptist, and Mercy Hospital. All right, let's bring over Dr. Hernandez-Rey.
Wow, thank you for that wonderful introduction. Don, it's so great to be on your show, and I appreciate the invitation.
Good evening. Thank you so much for joining us. And I know we have the True Oldies audience, and it's sponsored by All County Healthcare, and everyone's thinking, why are we discussing infertility, babies, PCOS? Why are we discussing this when our demographic is older? So I just want to lead with that question right out of the gate.
Well, we're not. I'm as a reproductive endocrinologist, I'm pretty familiar with the hormones that affect reproduction, the same way that I'm familiar with those same hormones that have a very significant impact on the second version of a woman's life, or the second stage of a woman's life, which is the perimenopause and the menopausal years, which is really almost 2/3 of a woman's life.
It's so interesting. We were talking before we started that we're contemporaries of age. Go you. It's all about the you.
Go you.
And back when we were in our, at least for me as a woman, 20s, 30s, I didn't think twice about, thankfully, being able to conceive, what the cycle was, even what hormones, other than just birth control and trying not to get pregnant when you didn't want to. Now, fast forward, hormones, menopause, it's a hot button everywhere. And it was definitely the conversation my mother never had with me.
Of course. And you're absolutely right. It's a different time, it's a different culture. And as contemporaries, when I was a second year resident, when I was a first year resident, we were giving out hormone replacement to all women who were perimenopausal or postmenopausal. And then the famous study, the WHI, came about, and all of a sudden, from one day to the next, we stopped providing any hormonal therapy to all women, not because the study was poorly designed or the results were flawed. It was interpreted incorrectly, unfortunately, by the media. And once that bag was, that was out of the bag, that information was out of the bag, it ran like wildfire, and there was no stopping the trend to stop hormone replacement therapy completely. And now we know that we've done a disservice to women in that age group at that time and for the last 25 years. And just now, the FDA has just removed a black box warning on, for example, estrogen replacement therapy. because in fact that study showed um, that that hormones cause breast cancer, when in fact what the results really showed is that estrogen therapy reduces breast cancer by about 23%.
And also, from what I understand, it helps with osteoporosis as well, hormone replacement therapy.
Absolutely. I've seen, believe it or not. And it's important that, when you say about the different demographic that's on this show, well, that, the women and men that are listening today, they also have daughters and they also have granddaughters who may find some of this information extremely important. Um, um, the hormones have always had a bad rap, so to speak. And we're trying to just bring the information and empower women to get a better knowledge. And as I was saying, I've seen two women, believe it or not. One is 34, Russian woman, who's lived here for about 10 years. And I saw a 23-year-old woman born and raised here, and they're both menopausal, which is, in anybody else's world, that's unfathomable. And unfortunately, in my world, that's something that we see pretty much on a weekly basis. And we know that these women who go into premature ovarian failure or insufficiency or early menopause will have a reduced lifespan compared to their age match controls who have a normal reproductive life. So that'll tell you the importance of hormone replacement therapy in that scenario and in all scenarios after women finish their reproductive years.
And at what ages are you even recommending to start hormone replacement? Is it perimenopause, or are we looking
It's
50s,
very
40s?
individualized.
Okay.
No, it's extremely individualized. Everybody presents different. Yeah, I always joke around uh, and I say this, kind of tongue in cheek. Women are so complex, not complicated, but very complex. Men are like amoebas. We're like one-celled organisms. And with regards to infertility, it'll tell you that, with one simple semen analysis, we know if a man is fertile or infertile or even subfertile. But with women, when they go through an evaluation, it's a significant number of testing that needs to be done in order to reach a potential diagnosis. And with menopause and treating menopause or perimenopause, it's not cookie cutter medicine. What works for one does not necessarily work for the other, even if they're identical twin sisters.
And what are some of the symptoms that you can see maybe replacing hormones for? And because I know it's not just estrogen. You're right. It's not cookie cutter. Some of you need testosterone. Some you're looking at progesterone, and then it's not just one dose. Are we looking at levels? Would someone recommend taking a blood test to see where we're at prior to administering anything?
No, no. So it's a great question, a very valid question. And in the world that we are in correct currently of wearables and AI and Aura rings and Fitbits and all of these things, everybody wants data. Everybody wants data. They're immersed in data, except they don't know how to interpret it. I myself, who wear an Apple Watch most of the time when working out in an Aura ring, it's just you're immersed in so much that you really don't even know how to dissect it. But so I understand the impetus for trying to measure blood, but really symptoms are sufficient enough to tell you how we're doing basically with the treatment that we've initiated and how to pivot based on the recall of those symptoms and how the people are doing,
So
the patients are doing.
symptoms, just hot flashes, or is there more to it?
No, no, the ton of many things. Going from in a very organized fashion from the head down, from uh, hair loss, hair thinning, to brain fog, to changes in eyesight and hearing, to changes
It's
in the oral mucosa, dentition, um, thyroid, skin changes, bone, as I think you alluded to a little bit before. When we think about osteopenia and osteoporosis, which are what they that stands for is basically thinning of the bones or bone loss. We think about big bones like the femur or the humerus, but what women or nobody thinks about is how about the bones in the face? We see a degeneration over time and the thinning of deterioration of the bone, which then affects the skin, the collagen, and that's where we get that aging appearance that you know uh, um, we see with time, and it doesn't matter what surgery or what you have done, it won't change that, or it just prolongs, helps to prolong those effects from happening. But there's bone back there that needs calcium and needs estrogen to be fortified, and now women are even putting estrogen on their skin. it's
I
it's
feel
it's
like you
all the
must have
rage
my
on
medical
TikTok.
records. On your skin. I feel like you have my medical records, and the first time I'm meeting you, because right, all of these symptoms that started, at least for me, in my 40s, with a thyroid diagnosis and thinning of hair and anxiety and all the things that just got kicked down the line. It was never labeled anything. It was just, let's treat it, let's throw another medication at it. Hormone
Suck it up,
replacement.
or suck it up.
Pretty much, you're a young mom, you've got kids, your husband's working. Totally. So I think our mothers never had the conversation, and now to open the conversation with your girlfriends or even your husbands, right? You're on the other side. What it's like to watch your wife or your patients or the wives go through it. You must have men that come in and say, my wife is having all of these symptoms, or intimacy is not the same. Or maybe they're afraid to even admit it, right? Because it's like taboo to even discuss in public.
I mean, I didn't even mention brain fog, fatigue, weight gain, centripetal weight gain, which is around the belly. There's a hormonal explanation for why this happens, and then what you discussed or we just mentioned is decreased libido, the changes in the vagina, the orgasmic effect, the all of those things change with time with the loss of hormones. But by the way, you mentioned men. It happens with men too. There's menopause and there's andropause. It just seems to happen a little bit later, and men seem to be a little bit more resistant to the changes over time, or those changes are more gradual, as opposed to women, where while there is the perimenopausal transition, they seem to affect a larger number of organ systems, like the ones we just discussed.
All right, we're going to take a quick commercial break. When we come back, Dr. Hernandez-Rey, I want to talk about andropause, because that is something in all the years that we've been hosting shows we've never touched on, because I think the men are under the impression I really have to suck it up, Buttercup, because I'm a guy. So it's a great conversation to come back to. More to come on the other side of this commercial break, and we'll be right back.
Happy to discuss.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. I am your host, Dawn Graubert. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. You can reach them at 954-717-7027. 7027. And as the rejoiner says, this is a show to ask all of the questions and touch on the topics you never knew you could ask. So we've got Dr. Armando Hernandez-Rey with us. He is a board certified reproductive endocrinologist and infertility specialist. But tonight we're talking hormones. And before we went to commercial break, you brought up andropause, men going through hormone changes. Menopause for women, now that it's suddenly open topic, we talk about it every which way. Men, there has to be changes, but somehow nobody discusses it. Why do you think that is?
We know very little about it, to be honest with you. But you'd be surprised how many men today are aware of these changes and are seeking care. Certainly in South Florida, we have many men who are on testosterone replacement therapy, which is basically the component that is missing with when a man goes through andropause. Obviously, there are other things as well, but as I said before, because you women are so complex, you have estrogen to deal with, progesterone to deal with, and testosterone, which is something that nowadays it was a big taboo many years ago, and now more and more it's being advocated for because it is something that women do need, and not necessarily for libido, but more for the purposes of building muscle mass, which is a great source of metabolism. And one of the things that happens with the menopause and the andropause is that we lose body composition, muscle composition, but muscle mass. And these hormones, once we lose them, there's no weightlifting, no resistance training will do enough to regain it. And that's what these medications and what these hormones are for in the atmosphere, replacing them.
And we're looking at two different types. So there's synthetic, maybe there's more than two, synthetic and bioidentical. What are the
Um,
differences?
e- Really, honestly, none. Only what social media puts out there, and this push for everything that is as natural as possible. And the studies are very convincing that there's just no difference. The only difference is the source of it, whether it comes in the lab or it comes in from nature. But the reality is that bioidentical doesn't mean that it came from a tree or a plant or anything else. It just means that is exactly the molecule that your ovary and or your testicle was producing way back when you were in the reproductive years. That's
And
all it means.
what about
Uh,
the delivery
and synthetic
system?
just means that it may just have a different composition so that you can absorb them in an easier way, or increasing the half-life of the medication that you're taking.
And the delivery system, patch, cream, pellet, you're
All of
seeing
the above.
differences?
Uh, yeah, I'm not a big fan of. It's not that not a big fan. It's just that the literature seems to be pretty convincing that pellets are something that we should try to stay away from, because of the inability to control the dosing, and particularly in women where they're mostly used. Um, you can have very adverse side effects that are irreversible, like thickening of the voice, enlargement of the clitoris, things that you cannot reverse with alternative therapy. But there are creams, transdermal applications, and there are definitively pills. I think the gold standard now for the delivery of estrogen is a transdermal approach. The reality is, again, that there is really very little contraindication to an oral uh, um, method of taking estrogen. The only reason to go for the transdermal is that it bypasses the liver, and then for those who are at risk, it puts them at less of a risk for blood clots, either peripherally or in as a stroke in the brain. But the numbers are so small that it's perfectly okay to, unless you know that you have a risk factor, to take oral estrogen as well as transdermal estrogen.
And for men, back to the andropause, what are some symptoms that men might be exhibiting?
Brain fog, fatigue, loss of muscle mass, libido, erectile dysfunction. uh, should note that as an infertility specialist, um, for men who are thinking about having children, uh, being on testosterone will render you infertile. It's reversible, but it will render you infertile because it will stop the production of sperm,
So definitely consult with your physician. So what
for
physician,
sure.
women, I guess, consult with their OBGYN. Now, some OBGYNs do prescribe hormone treatment and therapy. Others refer it out. What about for men? Who would they go see?
This is the cash. I mean, to be quite honest with you, this is the cash business, and
Okay.
so it's generally not covered by insurances unless you have like an absolute diagnosis. And so um, there's many physicians out there. There's nurse practitioners who are offering this service. Um, um, even I've even seen some dentist clinics offering replacement therapy the same way that they offer Botox and fillers, etc.
And it's so interesting because you had said to me, you've been in practice for 20 plus years. Your patients that you first started with now have children that are probably coming to you maybe for infertility, but now you're seeing these women go through different changes in life. Is that what almost catapulted you into now really looking at the different
I mean,
hormones?
I didn't ask for it. I didn't,
Showed
it just
up.
came organically. These patients that are their children are in college now that I saw when first began my practice, are coming to me for um, managing their menopause.
Totally. So interesting. And I want to touch base because you had told me we call them the younger generation. It's not always conceiving like it used to be when we were younger. You met your partner, you knew you wanted to have children. If you couldn't conceive, you went to a specialist. Treatments now are different. You're talking about people egg freezing and even sperm freezing. What are you finding
Yeah,
is
yeah, it's
the
incredible.
difference? Yeah.
The difference in terms of what, who's
As to
seeking this care
why
out?
generational, are they waiting
Yeah,
longer?
it's purely generational. These A lot of women um, are deciding to, we've this is all over the media. Women are career oriented. They want to postpone childbearing. I mean, let's not kid ourselves. Having a kid is tough, particularly when
Yeah.
you have a full-time job, and so they're trying to advance their profession, enjoy, let's call it enjoy their life without other responsibilities, but just you know doing what they want to do. And then the one way to do that is to forego those responsibilities, is to um, freeze eggs, freeze sperm, even freeze embryos. I've seen some couples who are just they get married, they're happy, but they're dinks as they call them, double income, no kids, and they want to travel, they want to explore the world. They have the resources to enjoy their time without necessarily committing to having the kids uh, right after they get married.
It's such an interesting conversation. I'm a new grandma. My granddaughter's 3 months old, and she was born.
Congratulations.
Thank you.
Congratulations.
Born in South Miami Hospital. They were just a fantastic, fabulous facility. The care was
I was born
fantastic.
there, so yeah, I'm sure
And to see
it's
it
come a long
come full
way.
cycle, go Canes,
Yeah,
as I'm driving down Ponce, I'm like, there's my dorm, and there's and there's the hospital. It's got to be such an incredible, fulfilling, full circle moment for you to see your first generation patients now second generation and come back to you. It says
it's
speaks
amazing.
volumes
It
for
also
you.
tells me that I'm getting old.
Wiser, I think. All right, so before we
Okay. Well,
wrap it up, Dr. Hernandez-Rey, I always want to ask one fun fact about you.
um, uh, I'll just love living life. I work hard, but I play very hard as well. I'm surrounded by an amazing family, great friends. I love my job, and I have a ton of hobbies. So that's what my dad said was the secret to life, and I'm holding him to it and following in his ways.
Incredible. Thank you so much, Dr. Hernandez-Rey, for joining us. It has been an absolute
Thank
pleasure
you,
to
Don, for
speak with
having
you.
me.
And I hope everyone who listening on True Oldies and watching us has answered some questions and opened up the conversation that none of this is taboo anymore for men or for women. For more information for All County, you can contact them at 954-717-7027, info@allcountyhealthcare.com. And you can find Dr. Armando Hernandez-Rey at 305-446-4673 or conceptionsflorida.com. Have a great evening, everyone. Thank you so much for joining us, and we will see you next week.